Greetings, this is the coronavirus COVID-19 update for 3/11/2020. And we always start out looking at the Chinese numbers. This is Baidu, a Chinese search engine, and they have set up a site with a lot of information on it. As you scroll down, the first thing you see is this chart. And the key numbers for this chart is a cumulative diagnosis, 80,980. That's only up 25 from yesterday. So we have China getting, 25 new cases a day, and the Western world, the world outside of China, up hundreds and several hundred a day sometimes. And cumulative cure, that's a little bit deceptive because China didn't cure 62,000 people. This is basically recoveries. Most people who get coronavirus have some symptoms and then they recover after a few days. Existing severe, these would be ICU patients, either organ failures, people that are really on the border, or bad cases of pneumonia. And cumulative deaths is 3,173, up 11 deaths from yesterday. Then as you scroll down, the next thing you see is a map, and I just started putting a few days worth of map on here because they started changing it lately. So this map now represents the total number of cases minus the number of cures. So you can see all the provinces in China getting lighter colored every day, except for Hubei province in the middle. And a change from yesterday, it looks like, I think that might be Harbin up north. You can see the dark area on the upper left map, and it's getting lighter today. And then there are three graphs, two together, and then you have to scroll down for the third one. So I put three of them together. They'll probably do that in a day or two. So this one, you can see a downward trend on just about everything except for cures. That's kind of been on an upward trend. And number of new deaths today, 11 in China. Sometimes these numbers don't equal the chart for some reason, even though I took them all at the same time. I wait till they finalize the chart and then I look at the graphs and stuff. So new diagnosis 25, added suspected cases 33, 1,320 people recovered. And then they have this non-Hubei province shown in gold on this graph, and Hubei in pink, and the national in red. And the national has more cases than Hubei, a lot more cases. It's usually really close. And then this is a new graph a couple days ago. They're plotting foreign new cases against Chinese new cases. So only 25 new cases in superior China, and the rest of the world 4,100 new cases today. So the next thing down after the two graphs is this list of regions or provinces in China. So it usually, well, sometimes it's by default it's open to Hubei, and it shows all the cities like Wuhan, and sometimes it's closed. Today it came closed, and I don't necessarily show it the default way. Sometimes I open it, sometimes I close it. But I wanted to see where, since there were some new cases outside of Hubei province today, I wanted to see where they were and show where they were. So Guangdong is the most populated province in China. It's down south, just north of Hong Kong, and it has the super cities of Guangzhou and Shenzhen. And I've never been to Guangzhou, but I've worked in Shenzhen. And Henan province is just west of Hubei province. It's the second most populated province in China. And there's not much going on in the rest of China. There's not much going on in China. And then they have this global map that they put in a few days ago, but it's not very accurate. And then there's a list of search topics today. So these are, what they call hot searches, but these are actually search terms that they use to find the hot stories of the day. So I usually look at 4 or 5 or 6, and I guess 7 of them are worth looking at today. The first topic is always the dynamics of COVID-19, which is what we just showed you in the first few charts and graphs. So that's the number one thing that Chinese people want to see. And then we'll go over some of these stories. So the first story on the left is Europe seeks help from China. The great China. Europe wants help from China. China is basically a communist dictatorship. So when they say lock down a city, the city locks down. The Western world isn't doing a very good job of that. Italy is supposed to be on lockdown. We should be on lockdown, but we're not. But anyways, some Chinese or some European people talked to this Chinese expert. Next, we have cancellation of a notice. This was the second story. So this is in Xiangjiang. Xiangjiang, Zhangjiang. And there was a notice that went out yesterday that said that this city, which is in Hubei province, would be the first city back to normal where they would lift all restrictions. And they said that is coming soon. And I guess probably too many people took advantage of it and started going out. So they canceled that notice and just said, no, we're still under restrictions. They didn't implement the new policy of letting people out anyway. It was just an announcement that it was going to happen, but now they pulled that. And then the story on the bottom right, starting on the 12th, people this is in Hefei province, city. And this is somebody getting on a bus showing their identification with their cell phone. So from now on, starting on the 12th, people who ride buses are going to have to show who they are. And who they are, I don't know if they're going to read it somehow or what. They're going to show the bus driver. And it probably will be tracked somewhere, especially if Beijing does it, because Beijing tracks everything. There's cameras everywhere. But this is a good idea. This would probably keep people who are known to be infected from roaming around on buses, because you have to show your ID. So if they find out later that you were infected and got on a bus, they might not like that. Then the next story is a new screening method. So China has developed a new test, where the results would be given in 15 minutes. There's actually a German test that's pretty close to that, really fast. And, I don't know how fast the American ones are. The CDC is a bunch of crack-smoking idiots, and, they're the ones that made a pandemic in the United States. And now the U.S. is out of control due to the CDC. So anyways, this is pretty good that they have a really fast test now. And up on the right, that was a story out of the United States. This is in Chinatown in the United States. They're running out of some herbal medicine, naturally from Chinese people wanting to go in and buy it. And on the bottom right is a story about a hospital where they closed the hospital. I guess it was one of these. It might have been one of those two big new hospitals that they built, or it might have been a makeshift hospital or something. But the hospital's now closed, and these people are now taking off their masks to show each other what they look like. The employees finally see, what the other employees look like. And this is the last story. What is this? So Huanggang in Hubei is resuming normal medical activity. So this is a hospital that was, committed to coronavirus, and now they're going to go back to, hey, we'll be looking at other parts of your anatomy if you have problems. So in other words, it's not a only coronavirus hospital anymore. So that's another good sign. Then there's not much news about China in the Western world. I spent some time looking, and this is a Washington Post article from some you know, this is not newsworthy. I just put it up here because it was the only thing I could find. These people, you get a bachelor's degree in journalism and then you write an article. Okay, mixed signs of recovery in China and South Korea. There might be some mixed signs of recovery in South Korea, but not in China. The only signs in China is a recovery. And what they mean by mixed sign is they're talking about people coming back into the country. So like 10 people came back into China with coronavirus. Now, is that newsworthy in a country with 1.3 billion people to say there's mixed signs because 10 people arrived in China that are, positive, tested positive? No. That's what you get when you have a bachelor's degree in journalism. You don't get the brightest people in the world. This is a Washington Post article, too. Then we go to the Johns Hopkins Global Tracker every day. And this is done by a research institute there, the Center for Systems Science and Engineering. On the bottom right, they can't make a graph, but the rest of the information in here is really, really good to have. So 125,865 total people in the world today and 4,600 deaths. 3,000 of those are in Hubei, and there's other countries that are trying to kill people, and catch up with China. And also, if you look down the list of cases, I didn't add these up, but I don't think the rest of the world is caught up with the number of cases in China yet, but they're trying. And then the big news today coming out of the WHO is that they have declared COVID-19 to be a pandemic. So people have been waiting for this to happen, and it's happened. So this is the first coronavirus that's actually turned into a pandemic. So there's been a lot of coronaviruses so far. The SARS and MERS are coronaviruses, and this is COVID-19, which is another one. So the first thing I do with the numbers today is I compare them with China. So Baidu on the bottom left shows 80,980 cases, and it's actually pretty close to what we say China has, 80,921. So we're only off by 59 cases there, which is the closest it's ever been. Sometimes it's off by several hundred. So then the next thing I do is take a look at the hot spots outside of China, which has been dominated by 3 countries for the last week or so, or a couple weeks. And some of these people are just going crazy, and so are the Johns Hopkins people. It was Italy, Iran, and South Korea. Then they changed it yesterday to Iran, Islamic Republic of, and the Republic of Korea, and now they switched them back today to Italy, Iran, and Korea South. So anyways, Italy went from 10,000 cases, 10,149 to 12,462. That's a huge jump in cases, and Italy's under lockdown. So that's pretty alarming, to go up a couple thousand, 2,300 cases. That's a big jump. Iran, nobody knows what's going on in Iran. It shows it went from 8,000 to 9,000. That's, contradicts what a lot of people believe. And then Republic of Korea or South Korea from 7,500 to 7,700. They went up a couple hundred. Things are looking pretty good in South Korea, and I think that might have something to do with the church, the efforts on the church. But if you look on the right, Italy went from, I don't usually do this. I took a snapshot of the deaths from yesterday, 631 to 827. In Iran, 291 to 354, and 54 to 60 in South Korea. That's not a very big increase. It's pretty alarming what's happening in Italy. So we'll take a look at the news on these countries. The big news out of Italy. A couple days ago, they did a lockdown on Lombardy province, and then yesterday they locked down all of Italy. And today, they announced that what's actually included in the lockdown: closed bars and shops, open food shops and pharmacies. and tobacco places. And then other news from coming out of Italy is on the upper left. Reaction to new government measures. I appeal to Italians to start listening to all this stuff. And then on the lower left from Time, you call this a lockdown. There's I guess president or prime minister is a little bit disappointed on what happened yesterday, the first day of the lockdown. So we got on TV today to appeal to everyone to actually do what they're supposed to do. On the upper right, Italians barred from Austria, so that's a new roadblock. On the bottom right, nobody will lose their job. Full support of health and families and businesses. So even though there's a lockdown, they're saying nobody's going to lose their job. I don't know how that's going to happen, but of the two countries in Europe who, if you read the global news before this coronavirus thing hit, Italy and Germany were both looking to have economically bad years. And also I put a little thing in here from yesterday. Italy records the highest single death toll. So that's 2 days in a row now that they've had the highest death toll. So that's pretty alarming for a country that's under lockdown. When China goes under lockdown, people get locked down. I have a lot of contacts in China, and I know what they're doing, and I chat with some of them, and they're not going out. Then we have Iran. So there was there's usually a lot of news out of Iran, but this was just some guy going around with a camera showing the outside world what's happening in Iran. So that middle picture, it's like a war. He goes in the hospital and he's shooting all these photos. These are patients wrapped up in sheets that are deceased. And then the upper right, those are patients in body bags. And then he went to a funeral place and saw dozens of funerals taking place. And in there it says, he says, today we saw 7 to 10 deaths, like the seven at the moment he went there, 7 to 10 funerals. And on the bottom right it says that the official death toll is less than 100, which is crazy. And then there's also video of this nurse or doctor at a hospital. After every shift I have to give a mask and gloves to patients, and they're just running out of supplies. Unfortunately, we have a shortage of proper attire and hygiene products. And she just went on forever. This is a really good video to watch, coming out of a site, canoe.com. And things are really, really bad in Iran, despite what you might hear from the official news agencies. Things are really bad. And then we go to, there's another, I just threw these two things on the top from Iran, because this comes from the Tehran Times, which is propaganda. Iranian-made medicine raises hope to treat. Yeah, I wonder how true that is. This isn't, hitting the rest of the world. I don't see anybody standing in line to buy Iranian medicine. And on the right, this, some idiot. Coronavirus has many features of biological warfare. That came out today. And another general saying, biological warfare is the United States. These idiots think that Americans hate Iranians, and like I said in the previous video a few days back, Americans hate the same thing the Iranians hate, and that's the leadership in Iran. So ask any college student. Okay, so after the 3 big hot spots, Italy, Iran, and South Korea, we're going to take a look at some more countries that are really getting up there. So we'll start with France, Spain, and Germany, see if we can find any global news to support these figures. Here you have France going from 784 cases, 1,784 to 2,284. So they're up 500 cases. Spain, 1,695 to 2,277. So that's from 1,700 to 2,200. That's a pretty good jump. And then Germany from 1,457 to 1,908. So there's 3 more countries out of control. So we'll start with France. So we start with France. So the news out of France is no news. There's if I use the same sites every day because I just have these sites open. France 24, and then I refresh the page every day. And they have a coronavirus page set up. There's no news about France though. There's news about the Premier League, Arsenal canceling a game, but of course that's in England. And then the connection, there's actually some news. Will France activate level 3 COVID-19 alert? Level 3 would be a lockdown, I guess. And France joins calls to stop ghost COVID-19 flights. Sometimes these flights, you have a flight maybe coming. I don't know if they understand the airplane business very well, airline business. They want to stop these, ghost flights where there's nobody there. Sometimes you have to get a plane back to another city because it's taken off from there tomorrow. Sometimes you have empty flights. I've flown on empty flights, but for a couple decades I get on an airplane every Monday morning and go to work, so I fly a lot. And I've been on an empty flight with only me. But this doesn't necessarily. I mean, I'm sure there's more empty flights now, but I don't think the airlines are just flying around to fly. They're flying to get the airplane somewhere. And this is Spain, upper left, how closing schools could increase a threat to Spain's elderly. This happens all over the world, and like in Japan and in Italy, the schools and God damn it. Then we have Germany. It's hard to find news out of Germany, so I just keep a couple sites open. Spiegel, that's a Mirror, and Die Welt, that's the World. These are 2 big German news sites. And, it's just really hard finding any information at all. So the Mirror has a story about, a district is paralyzed by coronavirus. This was ground zero. This is the first area that started, coming down with cases. And then on the right, you see a German town quarantines itself. Well, that's good. That's probably going to be the only way that American towns are going to get quarantined, is to do it themselves, because we don't have any, guidance coming from the CDC. And then Die Welt, the World, absolutely no news about coronavirus. So there's nothing going on in Germany, even though they went from 1,450 cases to 1,900, up 450 cases. No news about it. Then the United States. So the United States went from 971, depending on what time you looked at this yesterday, to 1,281, depending on what time you looked at it today. Deaths up from 28 to 36. And 29 of those deaths are in Washington. Basically the state of Washington, the Seattle area. There's 2 counties there. By the way, this Johns Hopkins thing, they went from cities a few days ago to states. So they're no longer, separating like Seattle King County from what was the other one? Simonish or something. I think it had more syllables than that. It's a county I've heard of before, but I forget the name of it. But those are the 2 heavy hit counties in the Seattle area. So you can see our pockets, where, I have another video to explain this, how the CDC is, an insane bunch of, crack smoking idiots. Our big areas here are Seattle, San Francisco, Los Angeles, New York, and Boston. And guess what? If you look at if you Google, hey, what cities have the most Chinese people living in, the highest density of Chinese people? It's those cities. So why didn't we have CDC testing centers in Seattle, San Francisco, LA, New York, and Boston? Why weren't there just testing centers there? Because viruses come from where? They come from China. It's not like I'm bashing Chinese Day here, Chinese Americans. If viruses came from bratwurst, we'd be looking at where German people are, because they might go home for the holiday and visit their ancestors and family. And, that's what Chinese people do. Chinese New Year, they took off to Wuhan. That's how we got infected. But the CDC said, oh, no, we're only going to test you if you've been to Wuhan. And then you have to send your test kits into Atlanta, and the kits don't work anyway. So what do we have as far as news coming out of the U.S. today? The big news, live update, Trump announces travel ban from most of Europe, and the WHO declares a pandemic for coronavirus. We already saw that. Upper right, we have the governor of the state of Washington announcing a bunch of new restrictions. King County, there's Snohomish County and Pierce counties, banning events with more than 250 people, and those include, there's a list of things they include there, all civic, religious, and other kinds of meetings, over 25 people banned. So this is a state taking some action for some counties, 3 counties in the state of Washington. If we have to rely on states coming out and mandating, regulations for counties, there's no hope for the U.S. ever recovering. There's no hope for the U.S. recovering anyway. It's a pandemic. Merkel from Germany came out yesterday and said that 70% of all Germans will get coronavirus. The same thing's going to happen in the U.S., 70%, because the CDC screwed up and they can't recover now. They screwed up too bad. And in the bottom, U.S. coronavirus cases surged past 1,000. Well, yeah, it's 1,281. It's probably up a lot more than that if I refresh that page. Up nearly tenfold in a week. Yep, that's what's happening. And you can see on the lower right there, that graph doesn't really do us any good. Then what other big news we have coming out of the U.S. today? Well, we have the NBA. The NBA suspends the season due to coronavirus. Some players tested positive, and they just suspended, the season. And that's, probably to not infect crowds. Basketball players come in pretty close contact with crowds. And also from the NCAA, tournaments will be played, but no fans. So you're going to see March Madness looking like that. And, hopefully your area, hopefully you don't live in the state of Washington where you can't go to a sports bar to watch a game. So everybody will be watching March Madness from home. Hopefully my sports bars are still open. And I think they are. And then the final piece, I made this because there is no map, there is no graph that shows you what's happening in the United States. So this is the number of cases. You can see it goes up every day. It was kind of tapered off from 547 to 607. I thought maybe there's hope of, containment, but no, it's like, up to 971 and up to 1281. We're going to see the U.S. go up to the levels of Italy and South Korea and maybe not Iran. Can't tell what their numbers are anyway. Okay, so it's a pandemic in the United States, and we're not going to stop this. I have another video showing you exactly what we have to deal with now. We have to contend with the United States, just everybody being infected, and what's going to happen? Old people are going to die, and young people are going to recover and then be immune to it. So that's what's going to happen. Can't stop it now. And that's all we have for today. Appreciate your time.